we had a patient and we were very worried about her. There was some unusual symptoms she was having. Her gastroenterologist wanted to do an upper and lower GI. Fantastic. He said, I'll do it. We had a hospital treatment room. We had anesthesiologist standing by. And the patient didn't show up for the appointment. Heartbreak, right? Because we could have put somebody in that slot.
Yeah.
Doctor said, okay, I'll give her a chance next month. Scheduled it again. Everything was lined up and she didn't show. And in the past, our response typically is 2 strikes in a situation like that. But we had a community health worker on our team who said, can I have one more chance? Can I go meet with her? Okay, you go do that. And so she set up lunch. The patient came to lunch. They talked. She said, we're really worried about you. We're worried there might be something happening that you need to treat. And she goes, well, so am I. I'm really scared. But Panera closes at 9:00. And we all said, what is Panera closing at 9:00? And we learned she was living in her car and she'd had nowhere to complete her prep for her colonoscopy. And she was too embarrassed to go to the hospital without having completed her prep. And thanks to that community health worker and that patient, we now raise money for all of our patients in a similar situation to have a night in a hotel for prep and a night after the procedure to recover.
Hello, you're listening to the Health Disparities Podcast from Movement is Life. I'm Dr. Mary O'Connor, Chair of the Board of Directors. Movement is Life advances joint health and mobility for women through community programs, education, and advocacy. Our work is guided by collaboration, evidence-based behavior change, and policy engagement, principles that drive lasting community-level transformation. Please join us for our Movement is Life 2026 Annual Summit in Detroit, Michigan on September 24th and 25th. For details and registration, you can visit our website, movementislifecommunity.org. Today, we're focusing on community-driven approaches that connect underserved individuals to specialty care, and we know how challenging that can be. Our guest is the amazing Angela Strain, Executive Director of We Care Jax, which coordinates donated specialty services for people who otherwise lack access. Angela, welcome, and thank you for joining us.
Thank you so much for having me today.
So, Angela, let's start. I have been so excited to meet you and interview you because, I live in Jacksonville Beach, and you've been doing this in Jacksonville, Florida now for a long time. And I've been fascinated with the model that you've created. So can you tell us a little bit about We Care Jax and the model that you use that is so effective for helping underserved individuals get specialty care?
Absolutely. Thank you so much for the request. We Care Jacksonville has been around for over 30 years. We were originally founded by members of the Duval Medical Society, and it started when those incredible volunteers were seeing patients for primary care in literally a church basement on a Sunday afternoon. And patients would wait in line and they would stay until the line was gone. And they realized while they could treat strep throat, they could treat something that was acute, they very often needed much more. They needed an x-ray or they needed a cardiologist consult. And so it was those original physician volunteers who started asking their colleagues, would you please see my patient? Would you please give an hour to this patient? And that's where we started. So that was quite a long time ago. Fast forward, the state of Florida actually created a legislative-based volunteer provider program. The state of Florida allows for any physician who donates their time, doesn't charge the patient, to receive sovereign immunity for the visit. And there's some other perks as well. Based on number of hours, they can also have their annual licensure fee waived, and they can also build some CMEs so that the work itself provides carrots in addition to just the feeling great about giving. And We Care has continued to grow ever since. We became an independent organization in the early 90s and celebrated our 30th anniversary just a few years ago. I'm sure every nonprofit you speak with says we'd love to be out of business, but we know that that's not happening anytime soon. And so we will be here to help coordinate that advanced diagnostic and specialty care that our uninsured and under-resourced neighbors need for as long as they need.
And so first of all, thank you. Thank you for all the work that you and the We Care Jax team does to support these individuals, our neighbors, people in our community, underserved individuals. What are some of the more common specialty needs of the people that you serve? You mentioned cardiology, and now I'm sure there's oncology, and of course orthopedics, because I'm an orthopedic surgeon. So,
and I'm going to talk to you after this call a little bit more about that. Sorry. Yes, we support 36 specialties right now. We work with the Safety Net primary care clinics here in Jacksonville. So there are 14 currently that are our partners. We believe that all care starts with primary care. The primary care provider is the quarterback. And when our clinic partners need support for a patient, that's when a referral is placed to We Care Jax. The most common one are things like x-rays, MRIs, ultrasounds. We make sure that patients get those. Then we move on from there. So pulmonology, cardiology, endocrinology, all the way up to oncology. That is the most complex case that we can get in the door. But I won't say it's the only one. So many of our neighbors have got comorbidities. They might be living with an autoimmune arthritis, plus they've got diabetes, plus they've got hypertension. As the conditions mount in the body, as you know, it takes a lot for someone to be able to get into treatment and to get on a pathway to really get them back to productivity and get them to a place where they're really healing. We want all of our neighbors to have the best opportunity for their greatest health. That's our vision. And so that means if we should come up with a patient who needs a specialty we haven't quite resourced, we're going to go out and ask. We're going to be knocking on doors. There are over 500 volunteer physicians in our database who have said yes, and that is amazing, but it's not the end. We see patients all the time with new things. We learn every day, which I don't think, I just know all of us have to keep learning. So when we come up with a new case, we might very well be out seeking a new specialty.
Mm-hmm. That's amazing. And I'm sure that, I hope that the volunteer physicians are reaching out to their colleagues and also tapping on them to help them support the cause as well.
And that truly is the best connection. Peer-to-peer, I'm sure, as you know, is always the most successful. So sometimes we will recruit either the physicians on our board or our longtime physician volunteers to make the first phone call to a new specialty, because truly we are a connected community. Duval is unique. We have a wonderful feeling of community spirit, and everybody knows everybody. We are just a few degrees of separation, it feels like, all over town, even though we're over 1 million people.
Right. I'm sure that there's a lot of challenges. There's always challenges, but some that come to mind that I think our listeners would be interested in is those kind of standard social determinants of health that are barriers for people to access the care that you're providing. So you've now figured out, okay, I can get a specialist to see you, but for that underserved individual that might have transportation challenges or language challenges, right? How are you addressing those barriers?
Right. Perfect question for this time, right? So we are, again, fortunate in Duval. The United Way team has a program called Ride United. And during regular hours of operation, if we know about the appointment in advance, we can book an appointment through Ride United to get Lyft to the patient's house to get them to their appointment. That is fantastic. It is a wonderful, huge lift. But from time to time, it's before hours, it's after hours. They're going for a surgery that might take them into the evening, or maybe they're going to be released on a Saturday. So we also raise money so that we too can offer Lyft to our patients. We, of course, work with the local JTA. We have the bus passes. Those are great, but when you need to see a doctor at a specific time and they don't like it when you're running late, we've got to make sure they're at the door. So raising money to make sure that we can supplement what Ride United is able to do is a huge part. We also have patients who need to travel safely if they've got a mobility device, if they've got a wheelchair.
Wow.
We've had to have patients transported to doctors while they were on stretchers. So there's local services to do that, but they are not cheap. It's about $150 round trip. So again, we're raising money to make sure that no patient has to say no to a doctor's appointment just because transportation is a barrier. For some, we also, raise money to do gas cards. Very often, somebody might have, a neighbor or a relative who's willing to go with them to an appointment, but they really need that extra help to make sure that the driver is made whole. So we are trying to be super creative in terms of transportation. We're 900 square miles here in Duval, and people live in every zip code that are our patients. So that is one of the more complex things, but tackling it is working as long as we can continue to raise money. In terms of language, we found ourselves in the situation a few years ago of not having the resources our network needed. And unfortunately, that often means that a provider or a clinic might say, oh, just bring a relative to do the translation.
Yeah.
We know that's not standard of care, right? A mother shouldn't have her teenage son trying to explain her health status to a doctor. So again, we've gone to our donors and said, hey, we need this. And we now subscribe to a program called Genie that has got over 180 languages. And it's a live video person who's doing the translation. They're all over the world. So you just log in and you say which language, and then you'll have someone there with you. And we think that's super important that you've got that visual, because so much of communication is nonverbal. You need to see how they're expressing. You need to see what that facial expression looks like, right? So we're delighted to have that. We, again, rely on our donors to help support it. And we hope that it is a standard that spreads throughout all the safety net, because it truly is the most patient-centric way to handle that.
How do you raise money?
Great
Because
question.
this is, no, I mean, isn't this is like this a central question, right? You can't provide this service. I mean, okay, the physicians are volunteering, but there's infrastructure costs, the cost that you just shared about, transporting patients, the cost of the language services. So how have you been so successful at the philanthropic effort, right, to keep the mission going?
We have been incredibly fortunate. We are at about 84% is grant funded, but not a single grant. So we've got more than 20 grant makers every year who we go to who help support us, including the city of Jacksonville, the public service grants. And there's also been, from time to time, a city of Jacksonville mayor, city council budget appropriation. Private foundations help us, and the rest is individuals. We have some amazing supporters who've been with us for many years, and some new ones with our new board members just over the last few. They've done creative things. We've had progressive dinners that a group did last summer, the Outdoorsy group. They hosted them for a month to help pay for some of the items we needed for our food pantry. We've had events in people's homes, events in restaurants, just trying to get the story out and have donors have an accessible opportunity to learn more. It is a privilege to get to tell the stories of our patients. And it's amazing, again, that Duval County is so generous. When you realize that every single person that we're talking about is truly your neighbor, it's hard to say no, right? It is hard to look at your neighbor and say, that's not a cause I can get behind. And basically, about every dollar that we raise brings in $25 of healthcare that is returned to the community. So the return on investment, if you are someone who loves that number piece, that is a fantastic investment in our local neighbors.
Wow. Amazing work, Angela. I mean, I am in awe And no, truly, I mean, it is, it's impressive and it's so meaningful and it's so important, the work that you're doing.
Thank you.
So are there certain policies, either local, state, national policies, that have supported We Care Jax in its journey to date? And then, of course, the next question, what kind of other policies would you like to see that would further support the mission and success?
Oh, that's a big one.
Yeah, it is a big one.
In 2024, March 2024, Governor DeSantis signed a packet of legislation, which is generally called Live Healthy. And in that legislation, he updated our volunteer provider program. So now we can actually see patients living at or below 300% of federal poverty level. It used to be 200. So that was a huge benefit. There are folks in our community living in that 200 to 300. Oh, go ahead.
Angela, if I can interrupt.
Sure.
Give some numbers to that, because I don't think that the average person understands, like,
right.
200 or 300% may sound like a lot, but it is not a lot.
That's right. So 100% of poverty, a person is making about $15,000 a year. And the average rent and utilities in Jacksonville is well over $24,000. So if you even think about what that means, just to keep my lights on, just to keep a roof over my head, I'm already disadvantaged if I am at 100% of poverty. So by taking it up just in the increments, that gives you that sense of where we are. A lot of folks think, oh, well, I would have thought that would have been plenty. No. And then you start looking at conditions like cancer. Cancer can lead to bankruptcy. Breast cancer patients, for example, have a 2.5 times more common incidence of filing bankruptcy within 5 years than any of their neighbors.
Mm-hmm.
Financial toxicity from a medical crisis can interrupt a whole family. That can interrupt generational wealth. It can keep you from going to school, sending your kids to school, starting your own business, buying a house. So that is a huge part of what our focus is. Interrupting that financial toxicity. We want every patient who leaves us to leave with zero medical debt. So all of the policies that help get us towards that solution for our neighbors are absolutely welcome. So that raise from the state to 300% means that we are able to work with folks who are in what is called the ALICE income set, asset limited, income constrained, employed. That in our community, the difference between 1 or 2 paychecks and losing everything. And that is something that, one of our founding staff members, Miss Freddie Webster, she said to me, the reason that people need to remember this is that we are all just a paycheck or 2 away from needing help. And I think that that's a huge message. In Jacksonville, 50% of our neighbors are either uninsured, on Medicaid, or accessing the Affordable Care Act for their health. 50%. And with the giant changes coming to Medicaid, the restriction, the reversal of the tax credits for the ACA, we know that we're going to be seeing even more of our neighbors fall back into the safety net. Those federal policies, to me, are some of the threats that we're facing. 140,000 of our neighbors are uninsured. Looking into the future, I can see that number growing exponentially when people fall out of Medicaid or fall off the Affordable Care Act.
I know, it's really shocking. I had to help one of my adult children, shop for healthcare insurance. And we're talking about a very extremely healthy young adult.
Sure.
And the cost is, it's crazy. I don't know another way to put it except it's absolutely crazy. And of course, there's high deductibles and out-of-pocket expenses. And so if you're out there trying to purchase health insurance, because it's not being supplied by your employer. It is brutal.
Right.
And I think that, probably the old terminology we would have for those people is the working poor, right? These are people that are working. I mean, they are trying to make it and improve their financial stability and care for their families. And they do not have access to insurance because they're doing jobs that don't provide employer-sponsored coverage.
Right.
And they do not generate the income that allows them to go out and purchase insurance on their own.
Yep.
Yes, it's
about 75% of our patients are working at least one or more part-time job. A lot since COVID have been in the gig economy. So delivering for Instacart, driving for Uber. A lot of those jobs have come online and people are taking advantage of that and doing the work that's available. There are no benefits associated. And very often we may have scheduled an appointment for a patient and they pick up a shift and they're looking at, can I pay my utilities or can I go to this doctor's appointment? And very often paying the utilities wins out. And so helping our neighbors who are going through all of this and facing it, very often it's about handholding and about encouragement and saying, hey, I know that that's an important thing. If we could get you into our food pantry this week to alleviate that bill, would you go to this doctor's appointment? And very often that's what has to happen, because when you have a family counting on you, you've got to be able to do it all. And unfortunately, for so many of our neighbors, it is a struggle.
Absolutely. And we know, is the money going to go to put food on the table, or is it going to go to pay for your medication?
Yes, that's a big one.
And we know in general, the answer is food on the table to feed the kids.
That's right.
Yeah.
That's right.
Angela, I want to go back to ask you what kind of advice you would give other communities that are looking to create essentially a replica of what we have here in Duval County with We Care Jax. So what kind of advice would you give them? Essential kind of building blocks and pitfalls to try and avoid?
Absolutely. I wish this was a program that we could take everywhere. The state of Florida is actually one of just a handful of states that has a volunteer provider program in its statutes. So one of the very first things I would recommend if you're not in Florida is to check out your state statute. Will your state offer sovereign immunity for your providers who are seeing patients at no cost, the way Florida is? That is one of the key pieces.
And what does that, let me see it, make sure I got this right. So the sovereign immunity means that I, as an orthopedic surgeon, go to a We Care Jacksonville clinic and I'm seeing patients there. I'm not charging them. I'm doing it as a volunteer. That while I could be sued by that patient, the state of Florida is providing my medical malpractice coverage. So I am not paying for it out of my pocket.
Correct.
And they would provide, obviously, the defense for me if I were to be, sued basically for malpractice.
Exactly. And that has been key to being able to bring all physicians who want to serve under the umbrella.
Yeah.
A lot of retired physicians aren't done yet. They've got plenty of skill and expertise they want to keep giving. I have an uncle in Tennessee who is in that exact situation, and he really wanted to volunteer, but unfortunately, Tennessee doesn't have a policy that would allow him to do so. So if you wanted to start a program like this, I would definitely start with, what does my state offer? What are the opportunities? Because having the volunteer physicians that say, yes, I'll see that patient, you've got to put yourself in their shoes. What would make it easier for them to say yes? What are the barriers to them to say yes? That is key. And then you've got to really continue the relationships. When our doctors say, yes, I'll see a patient, we also need to make sure that their practice administrator, their front office, their back office are saying yes with the doctor, because that's who makes the schedules. So those relationships are really important. And we are grateful in this city to have 5 incredible hospital systems Every one of them is working in some capacity to support the safety net. Some are sending residents in to do the work in the clinics themselves. Some are saying, yes, we'll help you with the patient who has cancer by offering that surgery at no cost or that infusion. Or we have a practice who's doing radiation oncology at no cost. All the relationships have to be built so that you can continue to offer that wide variety of care to the neighbors in your community. So that is where you have to start. It's all about people to people.
Wow, that's amazing. All right, let's do a few kind of rapid fire questions that people might be interested in. And the first one, I'll just give you three. One immediate policy you'd ask of local leaders and then of state leaders. Even though I know that Florida already has policies that are clearly essential to you building the model that you have, what more would help?
So we are again, fortunate in Duval. Both the mayor's office and city council has many champions for the work that we do with the safety net. One of the things that I would love for everyone to start doing is removing some of the stigma and bias. Words like, this is care for the indigent. Indigent sounds like a condition I can't get over. Uninsured, we can fix that. We can fix that. So very often, even if it isn't policy, it's even just the language that is used and really removing some of the bias. Our neighbors are baristas, they're construction workers, they're landscape contractors, they're dental hygienists who fall within the level of care that we offer. So we need to really get to a point where we're recognizing that maybe some old thoughts about who it is that needs this help, those need to go away.
And on the state level, is there something that, I should be calling Ron DeSantis? I don't have him on speed dial, but if I did, I could call Governor DeSantis and say, Angela needs this.
We need this. So one of the things right now that is moving through legislative session, we need an expansion in dental care. We need opportunities. The number one request that we get from new patients, besides access to healthcare, is I haven't seen a dentist in 3 or 4 years, or I've never seen a dentist. One of our clinics has a waiting list for their dental operatories of 1,200 patients right now. So the state is considering some legislation in its session on expanding funding for dental care. I know if that were to pass, right away, our community could use it. And truthfully, health is from the top of my head to the bottom of my toes. And if I don't have every system covered, including oral health, we're in trouble. So that's one that I'm hoping during this legislative session that they'll take up.
Yes, I think that there's a growing appreciation of the impact of oral health on overall health.
Absolutely.
Right. So it's not just about like preventing someone from getting cavities.
Right.
It goes far beyond that.
And when our cancer patients come in and they're going to have radiation oncology, we need dentists to be able to do a panoramic view, pull out any old metal fillings. There's just tons of work that has to be done before they can even get started in their treatment plan. So we need to have access to more dentists and more dental operatories and more opportunities for patients to see dental care throughout our safety net.
So for clinicians that are listening, what is one way that clinicians can get involved? Now, certainly those who live here in the Jacksonville area, that's easy. Reach out to you and We Care Jax. But even just broadly, clinicians across the country, we're a national podcast.
Yes.
Do most hospitals or healthcare systems have programs to support the underserved in their communities?
So that is a terrific question. Most hospital systems do have a way to financially support patients after the fact. Once they've got a bill, you can go in and ask for forgiveness or find a payment plan or please adjust it. But if you're really interested, There are clinics all over the country. Volunteers in Medicine, we have a local one here, but there are Volunteers in Medicine chapters all over the U.S. In my hometown of Memphis, the Church Health Center is the Volunteers in Medicine of that community. So physicians can look online to ask their peers who's doing that work. Federally qualified health centers, the FQHC movement started in the 60s, and it's nationwide now. And all of those facilities need a great body of physician volunteers and clinicians to support them. I can't imagine a single community that your podcast reaches where there's not someone who would love to have a clinician call them up or knock on the door and say, how can I help? We're all of us in the same boat when it comes to making sure that our neighbors who are uninsured have access.
Absolutely. Yeah. Angela, I'm going to close with, what has been the most rewarding aspect of this work for you personally? I mean, what sustains you through all the challenges of funding and operations? How do you keep going?
Well, that is a fantastic question. And I have to say, it is the individual stories that keep me going. We have a patient. If I have time for a patient story.
You do. We love patient stories.
Brilliant.
Patient stories are what it's all about.
Fantastic. So we have a fantastic relationship with Borland Groover, which is our local gastroenterology practice. And through them, we're able to serve patients with consults, but also colonoscopies, both those that are for regular wellness checks and those that are for symptoms. We had a patient and we were very worried about her. There was some unusual symptoms she was having. Her gastroenterologist wanted to do an upper and lower GI. Fantastic. He said, I'll do it. We had a hospital treatment room. We had anesthesiologist standing by. And the patient didn't show up for the appointment. Heartbreak, right? Because we could have put somebody in that slot.
Yeah.
Doctor said, okay, I'll give her a chance next month. Scheduled it again. Everything was lined up and she didn't show. And in the past, our response typically is 2 strikes in a situation like that. But we had a community health worker on our team who said, can I have one more chance? Can I go meet with her? Okay, you go do that. And so she set up lunch. The patient came to lunch. They talked. She said, we're really worried about you. We're worried there might be something happening that you need to treat. And she goes, well, so am I. I'm really scared. But Panera closes at 9:00. And we all said, what is Panera closing at 9:00? And we learned she was living in her car and she'd had nowhere to complete her prep for her colonoscopy. And she was too embarrassed to go to the hospital without having completed her prep. And thanks to that community health worker and that patient, we now raise money for all of our patients in a similar situation to have a night in a hotel for prep and a night after the procedure to recover. Just a little respite. And that has made all the difference. We went from a 50% show rate in gastroenterology with some changes. We now have a 90% show rate. And it just took a community health worker so committed to her patient that she said, please give me another chance. And I cannot tell you, the stories like that happen all the time. And that patient, she's now safely housed. She's in senior housing. Her community health worker helped her acquire Medicaid and Medicare. She's independent and she's healthy. And that wouldn't have happened if we had just stuck to the 2 strikes and you're out. So we've gotten rid of that. We're no longer saying that. We're saying, let's figure out how we can meet every single patient where they are and figure out what it is that's going on. The other word I wish we could get rid of is non-compliant. That is the worst word. Patients are not non-compliant. Patients are facing a situation where they don't know what the next step is. That patient didn't know how to solve the problem of prepping for her colonoscopy. My goodness, it didn't take a ton to just extend the hand and say, we're going to figure out a solution and it's going to work for you. And it's probably going to work for the next 10 patients in your situation too. So to me, that's what keeps me going. What are the problems we can solve? What are the things we can rethink? Respect is looking at a thing again, looking twice, truly respecting the people who come to us for care. That's what it's all about. And that keeps me going.
Angela, that is an amazing story. And I think partly because it really highlights how, you know, if you have never had anything close to that experience, how could you possibly even contemplate it, right? Like the idea that she kept missing these colonoscopy appointments because she had no place to go the night before for the prep, like would never have entered my mind.
Right.
And so it's really, again, being open to understanding, where is this individual right now? And how can you at We Care Jax solve these barriers for them?
Absolutely.
That is amazing. That is amazing. So, wow. Yeah, that's a great one. Congratulations.
Oh, well, congratulations to the community health worker who thought of it, and to all the supporters who came up and said yes. When we said, here's the challenge, supporters have come forward so that we're able to make that possible. We couldn't do the work without it.
Absolutely. All right, we'll wrap up. So Angela, I want to thank you for sharing these fantastic insights for the work that you and your team and the countless volunteer physicians and nurse practitioners and everyone else do every day. For listeners who want to learn more or get involved, please visit We Care Jax online. This wraps up this episode of the Health Disparities Podcast for Movement is Life. I'm Dr. Mary O'Connor. Until next time, be safe and be well.